As a diabetic, I know the importance of proper insulin injection techniques, and I want to show you how to do it. Giving myself insulin is simple. I just get all of my equipment ready, which is my insulin syringe, my alcohol pack, and my bottle of insulin. Always wash your hands properly before any insulin administration. You want to be sure that your hands are clean of any bacteria that can be transferred to the injection site. After I clean my hands, I'm going to carefully open my insulin syringe. And you can see the metered marks that indicate the number of units of insulin that you're going to draw up. Open cap, being careful not to touch the needle. You want to clean off your insulin top with an alcohol wipe with every administration. I'm going to draw up 5 units of insulin. Checking to be sure that it's on the line. There, we have it, 5 units. It's important to select an area of subcutaneous tissue. Subcutaneous tissue is the fatty part of the skin. So the most common areas for insulin injection are 4 quadrants of the belly, which typically are around the belly button. So you will have areas of fat here, 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 and here. And another area is the back of the arm, where you can pinch and feel the fat there. Those are the most common areas for subcutaneous insulin injections. For this demonstration, I'm going to select the lower left quadrant of my belly for this insulin administration. So I'm going to take my alcohol wipe and cleanse the area of administration. When we do this, we're going to start from the center, going in a concentric circle outward so as not to drag bacteria from one area to the other. You want to let the area dry naturally. You don't want to fan it, and you want to make sure that the alcohol has enough time to sit on the skin, eliminating the risk of bacteria. At this point, we're going to go ahead and pinch the area of insulin administration so as to bring up the fatty tissue. We inject at 45 degrees so as to avoid the underlying muscle and to allow the insulin to be put into the fatty tissue. Depress the plunger and wait a couple seconds and then remove. And that's it. Wasn't that easy? Make sure that the needle is securely covered by pressing up on the white lever on the insulin syringe. Always be sure to dispose of your needle in the proper receptacles. It's important that you rotate the injection sites. So in case you use the right lower quadrant on one administration, you would use the left lower quadrant on the next administration. And then you could rotate to the upper right quadrant and the left upper quadrant, and so forth. This prevents lumps, dents, and lipodystrophy. So I hope this has been helpful for you to learn how to administer your insulin. Insulin administration should not be a worrisome thing. If you follow the proper techniques, you can manage your blood sugar properly, safely, and effectively.